If we now concentrate on the dorsal radial zone of the wrist, we can palpate the radial styloid, and deep to it is the waist of the scaphoid. On the volar aspect of the hand is the scaphoid tubercle, which is a bony protuberance at the end of flexor carpi radialis. So ask the patient to flex forwards against resistance, and that's FCR. Extend the wrist. With ulnar deviation and radial deviation, the scaphoid tubercle becomes prominent with radial deviation, and that is the scaphoid flexing forwards. With ulnar deviation, it becomes less prominent as the scaphoid extends. The STT joint is somewhere around this area, and this can be a site of localized tenderness with degenerate joint disease. De Quervain's disease is tenosynovitis of the first extensor compartment, and patients will often describe pain along this line. Occasionally, in chronic situations, a lump can be felt. My provocation test for a De Quervain's disease is the Finkelstein's test, where I ask the patient to bend and flex their thumb forward, including the thumb interphalangeal joint, and ulnar deviate, and that will rapidly increase the pain along the line of this. You often only get to do this once because it's so painful. My test for base of thumb arthritis, if a patient has shouldering and obvious arthritis, I won't provoke that because it will be discomfort for the patient. But in equivocal cases, the provocation tests that you can perform are to axially load the thumb metacarpal against the trapezium. In this case, gently hold on to the thumb and push it in a longitudinal direction. One can circumduct the thumb CMC joint again to try and provoke some pain. Often the thumb CMC joint will sublux out of joint, and so a thumb to relocate the sublux joint may also cause some discomfort. And again, if this is combined with circumduction, is very suggestive of thumb CMC joint pain. Just below the CMC joint is the STT joint, and as we mentioned earlier, that when the scaphoid flexes and extends with radial and ulnar deviation, the scaphoid is wiping on the undersurface of the trapezium. So if the patient has ST arthritis, radial and ulnar deviation will cause pain as well as axially loading the joint.